Ophthalmoplegia refers to weakness or paralysis of one or more extraocular muscles which are responsible for eye movements. It is a physical finding in certain neurological illnesses. However, there are actually two types, external and internal. Now, external is what I'm referring to above, and this is a medical diagnosis code. Internal is a refraction diagnosis code. So let's look at the next slide. And on this slide, notice that we have different codes. It's H49. So these are not refraction codes. We have total external ophthalmoplegia. Once again, it's an exception with the unspecified being 0. And then we have progressive external ophthalmoplegia. Again, it also has a unspecified eye code of 0. On the next slide, we have internal ophthalmoplegia. That's characterized by a paresis of ciliary body with loss of power of accommodation and pupil dilation because of lesions of ciliary ganglion. Paresis means a weakness of voluntary movement. All of the codes below have laterality options. Notice that I've defaulted on my slides to the right eye only to conserve space. And these also follow the convention where 9 is the unspecified eye code. Now, in this section here, what we're now going to discuss are other codes that you might report when a patient presents and they may have like a refraction problem or no medical diagnosis or no refraction codes, and you're simply going to report signs and symptoms. Now, the first one is common. It's called floaters. This code has laterality, and I've listed the right eye. It's H43.391. The second very common code is halos, and that's H53.16. The next code is blurred vision, listed as other visual disturbances, H53.8. The next one is red eyes, H57.9. Eye pain also has laterality. This is the right eye code, H57.11. Another code that's common to report when a patient presents and they don't have any eye problems, but they're there for a screening, is hypertension, which is I10. This code includes essential benign and malignant. In ICD-9, there actually was a separate code for benign and malignant, and it appears to be combined in this ICD-10. Floaters are disorders of the vitreous body. They're little specks that people see when they're looking up close. A halo is a hazy ring around bright lights seen by some patients with refractive error or optical defects. Other common signs and symptoms include nausea and vomiting. And note that we have a code for nausea with vomiting, R11.2. Now, this is important because you never want to report the two codes separately. If there's ever a combination code that includes two conditions, you always report that. That is a coding convention. It's proper coding. H21.561 on the bottom is for non-reactive pupil, also known as a pupillary abnormality, and this has laterality. It's for the right eye only. Other visual disturbance codes include unspecified, the psychophysical. The one probably most common would be the one in the middle here, diplopia and double vision, H53.2. Now, a lot of carriers will consider these as signs and symptoms, or what we call not definitive diagnoses. So it will be by carrier if any pay on these. Again, but these should be reported if you don't have a definitive diagnosis. Other conditions are headache. Now, the unspecified headache code is R51, and I believe the headache NOS from ICD-9 will crosswalk to this code, R51. This code is the one I recommend not reporting because it's too vague. There are many types of headaches, and I'll discuss a little bit more about documentation. Another code common is diabetes controlled. There's no hyperglycemia or hypoglycemia, and the codes are E10.9 for type 1 and E11.9 for type 2. These two codes, most carriers will pay on the diabetes codes. Some carriers will pay on an office visit for a headache code, but it has to be a certain kind of headache. There are some that won't pay if you don't report the right kind of headache or if it's too vague. Again, you should get paid on diabetes without any manifestations. And the one on hypertension, I don't know of any carriers paying on the hypertension only, but I would recommend if you're going to use hypertension to justify your medical decision-making, to document in your assessment that you were screening for hypertensive diseases of the eye, and that can help you during an audit. Now, headaches, an intractable headache is a headache that simply just won't go away, and it's not responding to standard medications and therapies for headaches. The other term you'll see in headaches is status migrainosus, which refers to any migraine that persists longer than 72 hours. These two terms refer and are part of most headache codes. They need to be listed as either intractable or not intractable, or with status migrainosus or without it. So that's 4 options on every type of headache. So these apply to migraines, cluster headaches, post-traumatic, and other types of headaches. So what we're focusing here is simply on the documentation. And again, I go over these codes in much more detail in our longer course. The most common type of headache is a tension headache. And again, these are due to muscle tension and stress, and it's listed as unspecific, episodic, and chronic. Migraine headaches are due to a multitude of reasons, and they're commonly divided into common, classic, cluster, and complicated. However, that's not how ICD-10 organizes them. It has a different organization. Now, eye symptoms from headaches include geometric shapes, flash bulbs, jagged lines, heat waves, sparkling watery images, and even Swiss cheese patterns. So these are very, very important for eye care. And again, there's 2 categories, G43 and G44 for headaches. And again, my recommendation is now, early, is to focus on the documentation of headaches, but you do need to spend probably about a good 20 or 30 minutes learning all the headache codes, which we do cover in a complete course. Now, screening codes are also very, very important, and this is when a patient reports they don't have a medical diagnosis today, but they're being screened, for example, for a long-term use of a high-risk drug. The code in ICD-9 is V58.69, and in ICD-10 it will now become Z79.899, and that's what you would use for plaquenil use for rheumatoid arthritis. In addition, report the rheumatoid arthritis code M06.9. That is an unspecified code, and there are many, many more specific rheumatoid arthritis codes, but I understand you may not know exactly where it is, but there are more codes. Always report both codes, and I would link both to the office visit. Now, if the carrier does not pay on the Z code alone, then link to the M code first, or you may only link to the M code if you're having a problem getting paid. In addition, there are family and personal history codes that you should report. Again, anything like a family history of glaucoma or any other eye disorder is now a Z code. Down the bottom, we have personal history of malignant neoplasm. Now, this means they had a malignancy of the eye, and they're no longer being treated for it, and it's considered a personal history. Now, I don't know of any carriers that pay on an office visit linked to a history code, but once again, it is considered accurate coding, and it is part of the medical record. So other histories are ischemic heart disease, diabetes would be very important, any other endocrine system, and the last code is simply a status code, patient noncompliance. A lot of people are not aware of that code, and that will be Z91.19 in ICD-10. Now, we discussed all the medical diagnoses in the complete 6-hour course. Again, this was about 30 minutes, and you can see we really just covered a few codes and some concepts. So we actually cover well over 100 diseases in depth and numerous exceptions and subterms that most eye care professionals are not familiar with. Again, all my courses can be viewed like a video and paused or rewound. The online training is a per clinic fee, and you can watch the videos anytime, as many times as you want, until October 1st, 2014. Visit my website, ICodingForum.com, for more information. And also, you can send me an email at ecf@ICodingForum.com or call me at the number below. My name is Jeffrey Restuccio, and I am with the ICodingForum.com. And I thank you for viewing our presentation today.